Are you suffering from upper back, neck stiffness with pain due to forward rounded shoulder posture? If you're carrying your baby, breastfeeding, or in your computer, looking on your cell phone, and you need this upper back release, and you also ended up with some pelvic floor weakness, that when you laugh, sneeze, and cough, you have a leak, or you wake up in the middle of the night to use the restroom. Hi, my name is Annie, and welcome back to my channel, Annie Pilates Physical Therapist. Join me and my friend Vidhi for this lovely Pilates yoga flow using a foam roller and 2 lightweight dumbbells. If you don't have dumbbells, you can use bottled water, canned goods to engage these upper back muscles with proper breath work and core engagement. So let's begin the program first in seated position and cross-legged. And if you can't cross-leg, you can use the foam roller underneath your hips on your buttocks for support, so you can really keep your spine straight. So some patients with tightness on the hips, they can't cross legs. So this gives you a little bit elevated as support. How are you feeling, Vidhi, with that? It feels good, right? And when you're sitting on a very soft foam roller, and this is very soft, you can check out the link below. Comment foam, F-O-A-M, if you want the link directly to your messages, or click the link on the description. You can see my soft foam roller that you can buy right now. It will be shipping next month. And this will help engage your pelvic floor because that proprioception feedback, you can feel it on your sitting bones, because in the clock on the pelvic floor, as I said in some of my previous videos, it's like a diamond shape. The anterior portion, the posterior portion, and the midline is the sitting bones. We call it the ischial tuberosity, and that's the 9 o'clock to 3 o'clock line. And this is where we do our measurement, where we can differentiate the front part and the back part of our pelvic floor. And if you're in sitting position like this, it helps engage that area. This is the midline, which is so important for the basin of our pelvic floor. So let's begin with proper breath work. You can sit down first, place your hand on your abdomen to give that beautiful feedback, especially in the lower part on your ASIS, or we call that there's a bony prominence here, all the way near your pubis. And we're gonna do a beautiful breath work. So breath work is so important. So when you take a deep breath, your diaphragm goes down, diaphragmatic breathing. As you breathe in through your nose, you're gonna push your belly out. That will give that distension on your abdomen, and that will have a gentle stretch on your pelvic floor. And don't be afraid that it has a gentle stretch downward, because the diaphragm goes low. Down, pushes down to your organs all the way to your pelvic floor. And it became a piston motion. As you breathe out, what happens to your diaphragm? It goes back to concave, and slowly purse your lips and slowly breathe out the air, not quickly, so you can really suction it up. As you go up and in, which means if you have a zipper and you want to just close the zipper up and in, or you're gonna do a blueberry, imagine there's a blueberry size in your pee-pee all the way to your kidneys, as you slowly breathe out all at the same time as you exhale. Again, place your hands on your lower abdominal muscles near your pubis and your iliac crest, and take a deep breath through your nose. You can feel that beautiful distension as you exhale up and in. You want to lift, not downward pressure like this. Most patients with pelvic floor issues, they take a deep breath and then you can see their shoulders lifting, your chest rising. You don't want that. You know why? Because as you exhale, instead of lifting, your chest slowly go downward, your rib cage at your rib cage flare, go out, and guess what? Downward pressure instead of uplifting as you breathe out. Does it make sense? Again, inhale. See, my chest is still in the same position. I'm not raising my shoulders to my neck or my ears. I'm keeping my chest down. And you can also give that feedback by placing your hand on your chest if you have difficulty engaging your abdominal muscles and your diaphragmatic breathing. You don't want to be a chest breather. Inhale. Exhale. Up and in. And you can use your fingers to give that proprioceptive feedback of up and in. Again, inhale. And exhale. Well then, now grab the dumbbells. After the beautiful engagement of our pelvic floor, we're going to strengthen our shoulder external rotators. Most patients with forward rounded shoulder postures, the rotator cuff muscles are very weak and tight. So keeping your elbows on your waist, Thumbs up. Grab the dumbbells. Tight. Let's take a deep breath through your nose. Exhale, open to external rotation. Don't forget, up and in. Inhale, back center. Exhale, open. Keeping your elbows near your waist. Don't lift it up to the side like this. Keep it here for now to warm up. We have 4 more. Inhale, close in like a butterfly wings. Exhale. Breathe in, breathe out. 3 more. 2 and 1. Now from this position, we're gonna reach to the sides as you exhale. Inhale as you pull it in. And then exhale, reach. Breathe in. Exhale, reach. Keeping your upper back engaged. Inhale. Exhale. And the best way for the proper feedback is not just pulling your shoulders back, but depressing it down. Inhale, exhale, reach. 2 more. Don't forget, up and in. Last one. Hold this position and we'll do circles backward. Shoulder rolls backward. As you breathe in, breathe out. Inhale. Exhale, feel the burn now on your shoulders. Keep your elbows straight to engage your shoulder and scapular muscles. Breathe in, breathe out. And if you're getting tired, you can let go of the dumbbells so you can just do a rotation. 5, 4, 3, 2, and 1. We are increasing our endurance of our postural type 2 muscle fibers, our slow twitch muscle fibers. And that's why we're not doing it fast. We're doing it slow, controlled. From this position, extend it again. You're gonna feel the burn now, right? It's endurance, endurance, and lift. Raise, shoulder, flexion to abduction, eccentric control, and breathe out. Inhale, exhale, reach. Lateral raises. Targeting your deltoids. Shoulder down. Don't forget to squeeze down to engage those muscles. Inhale, exhale. 7 more. You're gonna feel the burn now, my friends. This is important to improve our posture and will help our pelvic floor muscles to prevent that downward pressure if you have anterior rib flare, especially if you have anterior pelvic tilt posture. 5 more. Feel the burn, my friends. 4. Breathe out as you lift. 3, 2, and 1, my friends. Hold this position. We're going to target our triceps. Our triceps are a group of muscles that should be really one of the strongest, especially for women. But for women, we are weak at this area. It needs to be strong. So you're going to lower your hands behind you as you inhale. Exhale, push forward. Inhale back. All the way back as you can with your elbows pointing to the heavens. Inhale, stretch. This opens your chest, right? Exhale. Breathe in. Breathe out. 7 more. Inhale. Exhale. 6. Inhale. Exhale. 5. Core engaged. Don't forget, up and in. 4. And if you need to take a break, that's fine. 3. 2. Last one, you might feel shaky now. And 1. Well done. Let's shake it off and rest our shoulders. Let's stretch our neck, especially if you have neck pain. Hold on to the foam roller on both hands and tilt your head side to side as you breathe in, breathe out. Switch to the other side. Take deep breaths and relax those shoulders and neck muscles. 2 more. Close your eyes if you like. Feel the tick and clicks on your neck and shoulders. 2 more. Just relax and take a breather. Now we're going to progress by using one hand over, touch the other side of your ear for a deeper stretch. Hold on to the foam roller so you can have a good grip as you stretch your upper traps. Tilt to the right as I'm pulling my left upper traps. Take a deep breath. And breath work is so important to release all the tension, regulates our nervous system. If you're holding your stress on your neck, it's best to let it go. Breathe in and breathe out. Well done. Now switch to the other side. Grab the foam roller on your right. Place your left hand over your right ear. Gently pull it to the side. Close your eyes so you can really feel the tension releasing as you breathe in. Breathe out. 2 more deep breaths. Last one. Well done. Now we're going to do a little bit tilt. It's important to stretch the deep neck flexors. So when you turn to the right, you look up. Hold that position. Take deep breaths. And then turn to the other side. Just turn, rotate, and then look up. Tilt up. Open those tight, deep neck muscles and rotators. Especially the deep neck flexors. Because we're always looking down on our phones. We're all guilty. I'm guilty in social media, you know. Breathe in and breathe out. Now we're going to do a gentle neck. Head rotation. Release all the stiffness, the ticks and clicks. If you have neck injury and there's no pain down your arm, that's fine. Continue. And then reverse circles. I feel more tick and clicks from my left to right with my neck injury from car accidents, fractured chest, and a back blow behind my head through the years of injuries. Let's take care of our neck. It's so important. Well done. Now clasp your hands, place it behind your head. And we're going to pull your elbows back. And we're going to do a gentle twist and rotation. So you pull and lift your right elbow and look up to the heavens. Feel that opening of your rib cage. So most patients with pelvic floor issues, they're very tight on their rib cage. Breathe in, back center. Exhale, switch to the other side. Inhale, back center. Exhale, switch. Breathe in, breathe out. 2 more. This is a great way to end your day or to begin your day. If you feel stiff in the morning, well done. Now from this position, we're going to do a beautiful stretch. Pull your elbows forward and lean forward. You can round your shoulders and your upper back to stretch all the way to your low back muscles. As you breathe in, breathe out. Lift your elbows out to the side and look up to the heavens. Rest your head on your hands that's interlocked and stretch and pull your both tip of your elbows back further. Breathe in, expand your abdominal muscles, not your chest, and exhale, lateral ribcage flare, and then exhale. As you bow down, pulling your elbows back to the center. And then slowly go up again to full straight position, looking up. Slowly put your eye gaze up to the ceiling as you pull your elbows back. As you breathe in, and then breathe out back to the center. Last one, my friends. Inhale as you lift your elbows up, eye gaze looking up to the heavens, extending your thoracic spine all the way to your lumbar. Breathe in and breathe out back down to the center. Well done. Now we are going to all fours position. Hold on to the foam roller. Because this is soft and it's only 3 inches, it's easier to grip. How are you feeling, Vidhi? Feels better, right? It releases all the tension if you have a lot of stress in your life to let it go. Now, we're going to do some beautiful bear plank. So bear plank is like planking but in all fours position without your knees straightening. You're just going to hover a few inches off the mat. Grab the mat with your toes as you breathe in. Exhale, lift off for a few inches. And exhale. Hold that position. 5, 4, 3, 2, and 1. And this helps strengthen your shoulders as well for the isometrics, making sure your hands are level to your shoulders, not too far like this or not too close, making sure your hands are level to your shoulders. As you breathe in, breathe out, lift. 5, 4, 3, 2, and 1. We have 3 more to go, my friends. Inhale, exhale, lift. As you lift, you exhale, and don't forget, zip it up and in. 3, 2, 1. Last set, my friends. Inhale, exhale, lift. 5, 4, 3, 2, and 1. And we're gonna do a beautiful scapular push-ups, which means you're keeping your elbows straight. Instead of doing the elbows bending, you're just lowering you're using your scapular muscles to go up and down towards the foam roller. It's like a push-up without bending your elbows, squeezing your scapular muscles as you go down and breathe out. Inhale as you press. Inhale, press. Exhale as you go down, slow and steady. Targeting those muscles, really thinking about these muscles, really engaging. 2 more. Last one. Well done. We are progressing. For those who want to progress, you can join me. We're going to combine bear plank with scapular press. Up and down. Are you guys ready? As you breathe in, breathe out, lift off. And we'll do 5 press up. 5, 4, 3, 2, and 1. Well done. Now we're gonna stretch our upper back and low back by doing a gentle child pose, lowering your hips down, pushing the foam roller forward, and resting your head all the way down to the mat for a beautiful stretch on your shoulders and upper back. As you breathe in, breathe out. Last deep breath in, and then slowly roll up. The next exercise, we're taking a breather. We're going back to some gentle bear hug. So you're gonna alternating pressed back and forth, just feeling the simple shifting of body weight, keeping your core engaged as you tap your hand to the opposite shoulder. As you exhale and tap, we'll do it 10 times. So we are progressing soon, and this is a great way if you're postpartum and your core is weak, you have diastasis recti or umbilical hernia. This is a great way to strengthen. And don't be afraid of the pressure in that area, and that's how we challenge, as long as there's no doming or coning on your abdominal muscles in the midline. And you can check it and feel your abdominal muscles like this. And as long as there's no pain. Well done. Now we're progressing by bear plank with shoulder taps or bear hugs. Are you ready? Take a deep breath through your nose and bear plank and bear hug. 10, 9, slow and steady. Control as you land your hand down to the foam roller. If it's too challenging, it's okay. Just continue with bear hug. 5, you don't have to plank for beginners. 4, 3, 2, and 1. Well done. That's why I love the foam roller. It's soft landing, right? Doesn't hurt your wrists. Now we're gonna stretch it out again, our upper back. But this time is puppy pose. You're gonna push the foam roller, keeping your hips up, not lowering down to your heels, but lowering your chest down. And stretch and hold this in 5 deep breaths. Targeting your upper back and your thoracic spine. Two more deep breaths in. And slowly roll up. And now we're going to do a little bit twisting to stretch your rib cage. So I'm going to place the foam roller diagonal to the right and stretch. As I keep my pelvis up, pointing to heavens to target my upper back muscles. Breathe in and breathe out. And then slowly go up. And then last set, we twist to the other side and lower your chest down. And take deep breaths. You're going to feel a beautiful stretch all the way to your shoulder tips, armpit, and rib cage. And that's it. I'm hoping you enjoyed this lovely mobility flow targeting our shoulder, neck, upper back, and core muscles. If you have stiffness, tightness on your neck with pain from lifting, carrying, and you're weak on your core muscles, as well as if you have diastasis recti, umbilical hernia, and latchkey bladder. If you love this video, want to learn more about Pilates, yoga, physical therapy, please subscribe to my channel, ring the bell so you won't miss anything. Every like you're giving to my channel, you are supporting me, and I'm so grateful to each one of you. And if you have more time today and you want to be guided specifically on how to revive your pelvic floor health, check the link down below. Join my 8-week challenge for summer. Or if you want to access my free 7-part video series, you can check out the link below, give your name and email address, and you'll receive my free 7-part video series on what is core back immersion therapy. I'll be relaunching my back masterclass, and to be part of life, if you want to be part of this amazing community to regain life without back pain, to have a stronger core and improved posture, there's a back masterclass free 6-part video series you can check out down below. And I'll be only accepting my first early bird waitlist of 20 students for this intimate class. If you have more time today, watch this video about core back immersion therapy, episode 1 and episode 2 on proper breath work. Or if you have radicular pain on your neck, watch this video about C6, C7 neck pain. Until my next video training, always remember, be safe, be well, and healthy you. Bye!